how many moments, even seconds perhaps, can you say you're fully present with your kids, with your partner, fully present? Not worried about emails, not worried about your accomplishments for the day, fully present with those kids.
I've never, ever taken a drug. I've never smoked pot. I didn't have my first drink till I was 24, 25. But to this day, I haven't. By the way, my entire neighborhood is microdosing.
So, some other people talk about it and like, you don't want to take this and then walk down the street in New York City. Welcome to the More You podcast, where we cut the and we get more you, more me, more Dom, and today more Dr. Damon Crone.
I had a busy practice, and I was a guy, because of my own trauma, who, if anyone had treatment-resistant depression, suicidality, PTSD, I was the guy who wanted to take on those cases. And so as a result of that, I'm a nerd as well. And so I've always been thinking about reading every research article, despite how, busy a practice can be. I because of my own tragedies and losses, I took on the cases that most folks didn't want to see. And so one part of that was always staying on the beat of what could move the needle very quickly. The other piece was I had to figure out a way to, especially now when I see a lot of special forces guys, first responders, folks who come into the office and have a suicide plan. I had to figure out a way to move the needle pretty quickly. That also coincided with a turning point in my life. 2019, my wife was diagnosed with cancer. Strangely, but not so strangely, because the mind is just this ineffable, crazy supercomputer. 2019, my wife's cancer diagnosis resuscitated a lot of the nightmares I had when my mother died, and so that all coincided to. If you can move the needle on treatment-resistant depression, and there's all of these studies resuscitated by one man at Johns Hopkins, Roland Griffiths, and the effect sizes are outrageous, I have to keep tracking this data and figure out how I can use this in my practice. Obviously, psilocybin's not legal. Classical psychedelics largely are not legal, but it was always pining at me. Yeah.
And the psilocybin is mushrooms for the general person, correct?
Yes. Yeah. Legalized in Oregon and Colorado. And there's, most states, the majority of states have active legislation around it. Still a Schedule I, has been since Nixon's presidency, which is egregious, but we can get into the reasons why it may.
So could we prescribe that before it was, or no, it's new.
Psychedelics are mind-altering, whereas a lot of SSRIs, whether you have generalized anxiety disorder, treatment-resistant depression, they try to diminish and temper, try to mitigate your symptoms. Psychedelics are enlightening and illuminating. And so, as you can imagine, different periods of time, context, political situations that can be threatening to folks.
Yeah. So go ahead now.
I was just going to say that. So that's like what you just said there. I just want to see if I capture this. You're basically saying it's suppression versus enlightenment. Suppression is just keeping it down, trying to keep it under the covers, where the enlightenment side is, no, we're actually going to deal with this. We're going to get this out in the open.
Truly. As an example, why I treat so many special forces guys, I've done a plethora of retreats now. How I started the Monarch Protocols. Well, first I was patient zero, but after that, I treated the special forces guys. So traumatic brain injury, depression, anxiety, comorbid substance abuse, because my thought was, if there's teeth to this protocol, if you can address the toughest cases, you can move the needle on what we call in the psych literature as healthy normals. Who, even us three, we all struggle at times.
Definitely
right?
us three.
and truly, and so what happens, especially in the special forces community, I've treated a lot of physicians too, is your symptoms are diminished. And so you have to find ways to self-medicate as opposed to confronting the beast, looking it head on. Freud called dreams the royal road to the unconscious. Psychedelics actually are the expedited route to the unconscious, which comes with a lot of responsibility and care when you're treating someone in that space.
It's a really good point. I think the podcast focuses on people like the three of us also a lot, and it's a kind of one of those hidden groups, these successful people who are working hard, are driven, doctors, CEOs, business owners, whatever, these people, lawyers, all these people developing, they're busy, we look busy, we're happy, we're making money, we have big families. Those are the ones who it's easy to kind of hide, right? Because you have this shield in front of you of like appearing to be doing awesome. Yeah. So it's interesting.
The number of times I saw a storied physician, head of surgery, vascular, whatever it is, head of the department in their 70s to corroborate a longitudinal study Harvard did. We have to compete and we have to be successful, of course. But what makes you tick, what people remember on their deathbed, where you don't want to be as a 70-year-old physician or high achiever is not knowing what makes your child tick, not knowing what derives meaning. And so it's not just the extreme cases I've seen, it's people you would never imagine, because we all have to cover, we all have to veil, right?
You know what I think is so therapeutic? I don't know. I'm sure it's happened to everybody. And you've been thinking something, and then you hear somebody else talk about it that they're experiencing, and it's that, oh my God, you're feeling that too. Like that's crazy. And I think that is obviously so therapeutic. So like you're saying, and like with Ben saying, like, look, we look around, we think everybody else has got it together. That just seems like a natural human psyche thing where you look around and think everybody else has it together because you're dealing internally, quietly with all of your own stuff. And then you come to find out that, oh no, everybody's dealing with something.
Except, what you're dealing with doesn't pop on Instagram. So, I mean, you can't post. So everybody's seeing only what it's even easier to create that facade, now you just post. I mean, listen, I'm a culprit, right? All I post on Instagram is my amazing results and how cool and, funny I am. Yeah, it's easy for me, but
one comment there, Ben. What I appreciate about you is you of course you have to compete in this environment, but fundamentally, I know your bones. Fundamentally, you are perfecting your craft. The likes, the whatever happens externally is a bonus. Of course.
Yes, true.
And so the issue, the conundrum that many folks face is, I only have many times to no fault of their own. Special Forces vet comes back. The VA doesn't want to treat them well. They are disillusioned, tempered with symptoms often that doesn't. So what my protocol does is, of course, we care about symptoms, but I want to attack the root of the symptoms. If we put a Band-Aid on something that is driving the symptoms, then you have a transitory effect. And so a lot of folks are disillusioned. A lot of folks have to wonder, does anyone give a crap about me? And so all that is to say, a lot of folks don't have an internal source of motivation and meaning to deal with the external, like or no like, fine. But,
Damon, I want to get to your protocol. I want to give it to everybody, but I want to make them listen a little longer. Who is like the classic person that this can help? Like, lay them out for us. Is it? Yeah, give us some.
The way I started my protocol is if I treatment-resistant depression, traumatic brain injury, anxiety, depression, and comorbid substance abuse, which is a lot of special forces guys, a lot of veterans.
Yeah, and that's also, it's got to be 60% of the population post-COVID. Like, we were all stuck in our house. I know I was throwing back too many beers during COVID. So it's like
unequivocally to the head of surgery at a fancy place who has burnout, who can't find meaning outside of shift after shift after shift, to the person who needs to problem solve. Creative block, psychedelics by default make you perceive and think about things differently. And so you can imagine why so many, Silicon Valley is an example, why so many use them for creative and problem solving abilities. So the spectrum is wild and large. What we can get in the nitty gritty dosage, clinical dosage versus someone who we call healthy normals in the literature. Is
so define a healthy. What's a healthy normal? Like somebody who doesn't have problems.
A healthy normal is not a clinical diagnosis, but I haven't met any successful person who I couldn't do an assessment with, and they would meet some criteria for depression and anxiety. Honest truth.
Okay. Gotcha. See, just everybody hear that, because that's incredible. What you just said. What you just said is any successful person, when you assess them, there's going to be something in there that's ticking off and highlighting depression or anxiety.
Unequivocally, because one variable I use is how many moments throughout the day. You two are high achievers. I try to achieve despite my flaws, but I'm always on the grind. Of course. How many moments in a day? How many moments, even seconds perhaps, can you say you're fully present with your kids, with your partner, fully present, not worried about emails, not worried about your accomplishments for the day, fully present with those kids? This is why I have such a strong interest, in part because of losses I've endured, is what's the good life? And in a context in which we have to achieve and incessantly achieve, what do I want to tell my kids and my wife on my deathbed? And one variable, how many moments can we be fully engaged? How many times have we had moments where we're like, damn it, the kids have four. I do feel like it. Both my boys play travel basketball and baseball, so I do feel like a Uber driver in some ways. But how many moments can we just sink in and say, this is what we should be doing outside of what
that's what it's about, man. I mean, it's a little bit morbid to think about it that way, but I think you're onto something, Damon.
Should we feel bad that maybe we're only present like 5 to 10%? Like, because if I think about it, I'm physically there, but I want to be there, and I keep pulling myself back in, but I keep going away.
It's a wonderful. I've pondered that a million times over. It's a wonderful question. As where most medication diminish, psychedelics enlighten, right? So psychedelics, regardless if it's a non-classical psychedelic like MDMA or ketamine, or classical psychedelics like psilocybin, they tell you a little bit about where you've been, where you're at, and where you need to go. So just the fact that you're pondering that question is a wonderful thing. I hope you don't beat yourself up around it, because what it means is you can psychedelics in the retreats and the data that I've done, they help people recalibrate to what's incredibly important. It doesn't matter if it's a surgeon, it doesn't matter if it's the special forces guy, it helps you dial in on your North Star. What gives me meaning at this point in my life? Because so much of 90% of our lives are on autopilot, and people start to wake up. Okay,
Damon, what are we talking about? Talk to me like I'm a freshman at MSU. It's Friday night, and we're going to get after what drugs are we talking about? You're talking about mushrooms.
Yep. So there's classical psychedelics with psilocybin, LSD, DMT, and mescaline. They're grouped together because all of them are serotonin 2A agonists. Psilocybin, as an example, looks almost identical to serotonin. The minor difference makes it highly selective to serotonin 2A. Non-classical psychedelics, we're talking about ketamine and MDMA. Unfortunately,
ecstasy.
Yep. Code name. Yep.
I mean, I think it's helpful for the listeners, the non-medical people, to get those names. So ecstasy, ketamine's another, I think, special K on the street, they call it. So these are really...
Is that what the kids call it? Is
they used to back in the day.
The kids are calling it special K? Okay,
yeah,
I just wanted to
like the cereal. So, okay, but now, I mean, it's true. I mean, those medications were popular back then because they did something. I mean, people start drugs because they do something good at the moment, at least. So now they're harnessing those to the degree that you get those dosages down, like you talked about, I guess.
Well, when you're talking about classical psychedelics or non-classical psychedelics, what is unequivocally true, and why, as a byproduct, you will get the Matthew Perrys, rest in peace. Any bad rap around psychedelics is related to two things: polysubstance use. You can't take a powerful neuroplastic agent, whether it's a serotonin 2A agonist or MDMA and ketamine, without proper rule-outs, clinical rule-outs, without proper set, meaning mindset. Is someone ready? And setting. You can't take these neuroplastic agents in a rave type atmosphere. And so,
yeah, I've heard that like some other people talk about it, and like, you don't want to take this and then walk down the street in New York City. You want to be like at your retreat, like around the woods or something like that.
True. So my protocol, it doesn't matter if it's ketamine or psilocybin. The myth about psychedelics is they're a panacea. Right? That's a huge risk, because if we get into a space where people think they can take one pill to change their life, take one substance to change their life, we are depriving folks of what it means to be human. We have to struggle. But more importantly, we're depriving folks of the most important piece. My protocol, as an example, whether it's ketamine or psilocybin, is embedded with a very serious therapy model. On the front end, we're doing clinical rule-outs. My medical director is making sure everything's kosher. On my end, I care about symptoms, but I'm attacking the roots, because when you have to deal with folks who come in with treatment-resistant depression and tell you that 6 weeks, they already have a plan, it's over, and you're their last stop, I have to think about every step of the way. How do you move the needle, right? And so there's nothing trivial. There's nothing rave-like. There is nothing about psychedelics that is not incredibly serious and intentional. And that starts with the preparation, and it starts with integration on the back end.
Could we, Ben, I was going to ask a question, and if you feel what you need to ask before is important. One of the things when I was looking at what you do and how you do it, there's something that it was like on your site, which I thought was pretty controversial, and I kind of loved it, which was, you don't believe in the same problem, the same therapist for years and years of therapy. It feels like what you've created is like bootcamp therapy more than anything else. Do I have that right?
No, I appreciate that. I have so just a little context, Michigan, Kalamazoo College, which Ben knows, moved
KZoo.
Get KZoo.
Great college.
Incredible college. I was a lost boy in many ways. I had dealt with a semi truck driver, had ran a stoplight, and the only damn stoplight we had in town where I grew up. And unfortunately, my mother passed. I had an uncle commit suicide, a cousin, my uncle's son, unfortunately commit suicide. And so I had to think about, how do we disrupt complacency? And why I share the graduate piece is, my program, they couldn't mandate it, but as every program should, if you're going to be a provider, you should do some in-depth work as on the client side to know your own demons, your ghosts. And I had incredible therapists. So I don't mean this to diminish therapy. I'm always a huge advocate, obviously. But there came a point in my life where psychedelics, psilocybin in particular for me, did which has been corroborated and highlighted by so many now in my protocols. Psilocybin did more for me in 4 hours than about 10 years of wonderful therapy. So to your point, there's a couple things that go into that. Number one, doesn't matter the medication. You can have an infection and need penicillin. If you don't take it, right, it's not going to help. You have to be ready for it, and you have to have someone with delicate hands who knows how to guide you and has done all the proper rule outs to get you where you need to be. The blessing has been, the way I tell folks is if you wake up every day and it feels like every step to get to where you need to be is like climbing Kilimanjaro, psychedelics can take you to the top and give you options on how you want to come down. And that's been really cool, especially for the cases where they are wedded to being done.
What do you think it is that makes people be able to grow from it? Like what is it? Does it, because you hear different theories, even as a doctor, I don't really understand what people are saying, but it like resets the mind. Is it the neuroplasticity? It makes you think about things that you couldn't think about. It kind of lets you realize your potential. I mean, what do you really think it is that allows people to do that?
It's a wonderful question. I'll give you, I'm not a neuroscientist by any stretch of the imagination. I'm a clinician, but I'll give you Robin Carhart Harris's work. He's at UCSF. David Olson's another innovator. He's at UCSD. Robin's work, he went from Imperial College London, did functional MRI studies around psychedelics, and now he's at UCSF. So I'll give you my poor take on the neuroscience, and then I'll tell you what happens clinically. Neuroscience level, psychedelics force you to think about your suffering in the world differently. So classical psychedelics, as an example, temper blood flow to your default mode network, right? The default mode network's our ego, the self-referential part that beats us up for things that we did in the past, the parts that worries about anticipatory fears that never come to fruition. One of my late great mentors found in his research that 90% of our lives are spent on autopilot, and 90% of what we worry about, even if we have generalized anxiety disorder as a diagnosis, are things that never come to fruition. Think about that. We live, and he even did some interesting studies where your peripheral vision starts to change the more and more you become anxious and on autopilot. Think about that. What psychedelics inevitably do, literally do, is they temper blood flow to the area of the brain that forces you to have self-referential thoughts, light up areas in the brain that don't typically talk to each other, don't speak to each other. And so what happens, right? You're forced to have a novel perspective. You're forced, ketamine as an example, which is a dissociative anesthetic, right? It removes the physical pain. And so you can look at a situation a little bit differently. Psilocybin, as an example, classical serotonin 2A agonist, it forces you to have a novel experience in ways that are just like, it's hard for me even to articulate what folks go through.
Okay, no, that was helpful. That was really useful, you know. And when they've done these fMRI studies, I assume, on people with these severe anxiety and depression disorders. So do they show the opposite? Do they show increased blood flow to those areas compared to the more whatever creative new areas?
Yeah, they absolutely. And so and they'll actually have folks do creative problem solving, and they'll control for IQ, they'll control for what is a normal task for someone with at this level. Doesn't matter if it's someone who works in X, Y, and Z versus someone who has to do a lot of executive decision making, and lights up areas that just force you to think about things in novel ways.
Can we just dig into that for just a second? By the way, it's just fascinating me, and it's fascinating because I've never ever taken a drug. I've never smoked pot. I didn't have my first drink till I was 24, 25. But to this day I haven't. By the way, my entire neighborhood is microdosing. Like it's like a nonstop microdose in this neighborhood everywhere.
He's in Canada. He's in Canada, Damon.
Psilocybin or LSD?
I think it's psilocybin. I think it's psilocybin. So, I had someone say to me like, "Hey, this psilocybin treatment is incredible, and the way you're explaining it is so easy to get your hands around it." What do you say to someone like myself who's like, I'm frightened of my brain, and I'm very afraid to go into this type of situation? What do you tell people, that feel like that? Hence why I need psilocybin treatment. But
one, I'm encouraged by it, because if you don't have some trepidation, if you're not equivocating to some extent, then in my protocol, I read, okay, I need to do further assessment. And so for you as an example, because you are a successful person, I don't know you and I can't pretend to know the hell you've been through, but you've in part dealt with that hell by one survival strategy. I will set myself up and be successful in all of these spaces. The unconscious brain, even if it's bad, reads familiarity and what is familial. And so if you find a survival strategy, how could you not feel, and it's led to objective success, even if you're silently suffering at times? I hope you're not, but how could your mind not feel anxious about what is all of this? I haven't drank, I haven't done excuse me, X, Y, and Z. How could you not have trepidation? The impact on so many of us who are, and I fall into this category, who are just crazy perfectionistic, obsessive, in control has been one of my survival mechanisms. You'd do quite well. I'd have to do a rule, but your anxiety, of course, because it's novel. It's not considered, standard. If you go to your PCP, you're not getting psilocybin or a dose of LSD, right? So there is, just by default of its novelty, there's a era of anxiety around it. What is this? And our mind registers fear for anything that's novel, even if what's novel is good for us.
It's interesting. It makes sense why, and I'm sure there's people who are maybe not, I don't want to say not as successful, but it makes sense why really successful type A people reinforce these kind of problems, right? Because you kind of are proving like, hey, it's whatever I'm doing is working, even if what you're doing is really bad for you mentally, but the objective outcome is positive, it doesn't matter. Like, the surgeon who works 80 hours a week and drinks at night, but who cares if he's doing good surgery, getting good outcomes, making him a lot of money, like he's reinforcing that to himself or herself.
Unequivocal. So to your point, Ben, one of the things I do during my integration after folks leave a retreat is we have to be consciously intentional about the changes we're making. Psychedelics give you a neuroplastic window, what we call a critical relearning period, to change thoughts, behaviors, and habits. If left to your own devices without being consciously intentional about how to change, you will go back into autopilot, because we have kids, we have families, we have responsibilities. It is imbued and ingrained in all of us that let's meet this next goal, and that'll engender happiness. Let's get to the net, and the goalpost obviously keeps moving. What Harvard calls the hedonic treadmill. What's the next achievement? What's the next buy? What's the next purchase that will make us feel good? What psychedelics do is help you cut through all of that and say, what is it about my soul? What is it about what I value the deepest that I can use to clarify in a way that I can incorporate in my daily life? This is not treatments that make people, there are some nefarious actors in this space, but this is a treatment that is clarifying, enlightening, and we take that insight and say, how do we incorporate this into your daily life? I treat special forces guys who have, on average, have tried to kill themselves more times than anyone would want to imagine. I have to worry about what happens when people go back to their daily operating system. right? And so psychedelics, when done properly, can get you out of the rabbit hole, the chasing, the autopilot. And it's not that it's not going to be a personality shift. If done properly, it's going to be a shift to know what values you've been sleeping on that actually engender more meaning than you ever imagined.
That's interesting. I was going to get to that. Like, what's the safety protocol on this stuff? Like, what's the worst case scenario? I mean, ketamine's a very safe drug because it doesn't have much risk to it by itself. I know that. We use that in surgery. Yeah.
True. Ketamine, as an example, obviously you can use it in any state. FDA approved since late 50s, was used as anesthetic in Vietnam. Psilocybin, to say it's a Schedule 1 is egregious. It's not addictive, as other classical psychedelics
break
are
down
not.
what you mean for the. You probably know this better than me. For like Schedule 1, what does that mean for the general person out there?
It means it's federally illegal, and so Oregon and Colorado, as an example, legalizing psilocybin in all the states. There's last I checked, I mean, Illinois has one on the docket. Michigan, a ton of states have something in legislation to use psilocybin for medical purposes.
So does that move it to Schedule 2, or no? It stays as a Schedule 1.
It stays as Schedule 1.
Or you have to be prescribed by a physician of some sort.
The Schedule 1 piece is that it doesn't have any medical uses and it's addictive. There is not a darn thing about any of these, especially classical psychedelics, that don't have medicinal uses and are addictive. They have that rap because of many reasons that I don't know if we have time for. But we can talk a little bit about pharma if we want to.
We don't want our cars to blow up, you know what I mean? So.
That's right. We gotta stay safe. You're in LA. Stay safe at the hotel.
Stay safe. He's got to fly on a plane.
Yeah.
But I guess, Damon, one of the things that you just said, which I thought was really interesting, which is the after protocol seems incredibly important. Going in, is this a one and done though from a psilocybin point of view?
So it's a great question. So I have 15 data points now where there's been, with psilocybin, 2 doses, where there's been the most extreme depression, anxiety, and comorbid substance abuse. And all 15 are at either 12 to 15 months completely sober. Some are high achieving physicians, some are special forces guys. All that is to say, we'd have more data points, but it's such a great question. But we can't study the effects, whether it's 1 dose or 2 doses, outside of clinicians like myself tracking that. So, what psilocybin, as an example, you have to dose one down off of an SSRI they're on because we have to worry about serotonin syndrome. We don't know necessarily how legit that is, but when it's a Schedule 1 and federally illegal, you can imagine research funding is
the risk
not rampant for psilocybin. And so what in my protocol, two doses on what we call the heroic dose. Again, if it's kosher for someone, has ameliorated depression, anxiety, obsessive issues, and particularly substance abuse,
how long between the doses?
So generally there's 2 to 3 months in between doses.
Okay, I want to simplify this for some of the listeners out there. So serotonin makes you feel good, right? In theory, I'm going to really dumb this down. So the SSRIs stop that from being absorbed, right? So it allows you to have more available for your brain.
Yeah, true. So serotonin, mood, sleep, many metabolic processes. But
to simplify, and then the psychedelics stimulate the same receptors as serotonin itself.
And they're in classical psychedelics, unlike SSRIs. SSRIs often get absorbed quite a bit in the gut, right? So then you get people who feel bloating, after the effects wear off, they may have, insomnia, they may have lethargy. Classical psychedelics, conversely, are very selective with one particular serotonin receptor. So I share that because I don't want folks to stop SSRIs. If you're pondering that, some are incredibly useful for folks.
It saved millions of lives,
truly,
no doubt.
Truly. But if you have something that is very selective, and can activate something that we know the outcome about. So there's a reason you have hallucinogenic effects when you take psilocybin, LSD, DMT, or mescaline, the compound from the peyote plant, cacti. It binds to serotonin receptors in the visual cortex. And so, of course, you're going to have hallucinogenic effects. A lot of standard serotonin agents get caught up in the gut because they're not selective, help folks for a period of time, but then the effects start to wear off.
But that's why you have to, if you're going to do the treatment, the serotonin syndrome, you could explain that a little bit to us.
Yeah,
I haven't thought about that since med school, so I don't want to.
Yeah, no. So so ketamine is very safe from medical standpoint. In other words, if someone's on the highest dose of Lexapro, Zoloft, doesn't matter. You can still
do ketamine simultaneously.
100%. Psilocybin, because of its action on serotonin 2A, we don't know exactly yet, but rightfully so. The research studies that we funded to date say, let's be on the safe side. So let's not add a serotonin agonist if someone's taken an SSRI. So in other words, we don't know exactly why ketamine has the most data is because it mechanism of action, right, doesn't affect much. The only cases I've seen with ketamine is if someone might get a little bit nauseous.
Like if you feel great, like for instance, today I feel amazing. I'm happy. I'm in a good mood. Is this the right time to actually do the protocol? Or is it when you're actually experiencing like acute depression or anxiety?
It's a great question. So because of the cases I've seen and the severity of cases, most of my work has been on the most extreme clinical cases. However, if you have to be thoughtful, and it's a hard question to answer on the other side because I run on the side of if any part of me feels like it's not indicated or not safe, I won't do it. And so to our earlier point, you expressing some anxiety and trepidation about psychedelics is one of my first indicators on my protocol. Is someone really excited? And to the audience, do not do any psychedelic unless you have someone who knows, who has some salt and knows what they're doing. What has happened over time, especially in the past 5 years, is because in doses that are safe and from providers that know what they're doing, a lot of people who don't have clinical conditions have used it for things like creative blocks. I have this conundrum, I need to find direction. Those are not clinically indicated conditions because when Roland Griffiths resuscitated the psychedelic research, and we've seen this expansion, and MDMA we can talk more about, that is a whole other beast. But what has happened is that when you experience a psychedelic thoughtfully, it shifts your perspective so deeply, whether you're the 70-year-old physician or whether you're the special forces guy dealing with so much trauma. It shifts it where, if done properly, you have to think about the world differently. So that's not a great answer to your question, but what the clinical indications will take some time because funding for it is quite challenging, quite arduous.
Can I ask that question a different way, Damon? Would you rather have would you rather have someone show up completely calm and not experiencing, call it, symptoms at the time, or would you rather them be showing up with those symptoms?
The former, certainly.
Okay.
But the hard part in terms of how to answer that is we all have masks, right? We all have veils. So the person who shows up, who appears to be just locked in, electric, has everything we all imagine in terms of what reads as success, that person may be quiet. That person may read as the most clinically depressed person in the room, because we've all, and conversely, right, the person who shows up with trauma, PTSD symptoms, as an example, may be the most resourceful, resilient person in the room, but just got triggered from hearing a gunshot, hearing an ambulance, whatever the case may be. So it's nuanced, and I know it's really tricky. What it comes down to is you have to have someone who can make the right clinical assessment, because these are very powerful neuroplastic agents, and you want to be thoughtful about why you're using it and your goals and where one wants to go. And it doesn't matter if it's the Mayo, head of surgery, or the vet. You still have to be, you have to disabuse yourself of the idea that their external symptoms will direct my assessment. We of course think about that, but it's why the assessment piece is so crucial, because what dictates whether or not one person has a good experience or not is how well you do your clinical assessment.
Yeah, I like, Damon, you said that if it's done thoughtfully. I think that's a really nice way to say it. Yeah. We should probably at least get the bird's eye view of your protocol, I think.
So I was going to ask that. I was going to say,
yeah.
Ben, we're like totally on the same page, because I want to jump into the business for a second.
Yeah.
Like I want to know about the business, but before the business, I think, Ben, ESP, my man, I want to just, if you could quickly just take us through the protocol, just so people can understand just the basics around that. I think that'd be amazing.
Certainly. So as an example, Ben comes to me. He reports burnout. Maybe some anxiety. Maybe he's a little bit impatient with Maria. What a gem. But say he reports, I'm doing pretty well, but here are my surface level symptoms. What I do in my protocol is I have a method. My training is contemporary psychodynamic theory, which presumes that symptoms, you can have a shiny roof, but if your foundation is leaking, the shiny roof doesn't matter. So addressing the symptoms, attacking the symptoms are only helpful in a transitory way. So someone comes to me, I have 3 sessions where I am looking beyond what we call DSM sort of diagnostic categories. I am using the first 3 preparation sessions to attack what are the roots driving one's symptoms.
And what are those? Those are like normal psychotherapy sessions or whatever, like 1 hour visit kind of thing?
Yep. Those are 3 1-hour sessions that we have. And part of that too is my medical director has to do his medical assessment. Again, to engender safety, we won't do anything that's not indicated. We've not generally. We have done blood work, and this gets into the ibogaine space with opioid use disorders. We have had to do blood work at times, but for the most part, we don't have to. There's 3 sessions that I have that is helping me take a developmental perspective on how did this person get from childhood to recreating? This is part of psychodynamic theory in my training. How do we recreate unconsciously on autopilot the very issues that we've dealt with historically? No one disputes the fact that we set up patterns and formulations and templates in our mind from an early age, and we recreate them. right? And even hardcore neuroscientists don't dispute that any longer. So the first 3 prep sessions outside of the medical intake to rule out any precluding variables on the medical side is, to me, for me to get to the roots. If people meet the medical clearance and meet my psychological assessment, there are some rule outs. We can't treat folks who have schizophrenia and have active psychosis, whether it's ketamine, MDMA, or classical psychedelics in particular. If they meet that, then I have folks come on site to an immersive retreat experience where they have 3 days of incredible enlightening work. They leave. This is a short way to say this. They leave and then they go home, and I do 3 integration sessions. So we take that experience and the insight that they experience, and we think about how do we use that to make you incorporate all of these gains contingent on your goals, not mine. Everyone has idiosyncratic goals, but how do we take that experience and Monday through Friday, you're incorporating this insight in relation to your goals, and we make this work in service of change.
Got it. And
are you
on
like
the retreat,
writing?
is it like
Yeah.
like what's it like? Like what's it physically like at the retreat?
It's intense. It's intense. I always, so the best case example I can get, I mean many, but the best case example, again, because I started this protocol with the most traumatized folks with TBI, comorbid substance abuse. I've had folks reenact trauma, whether it's on ketamine or psilocybin, literally go back in time, reenact the entire most traumatic memory. And so I share that because you can have folks contingent on their trauma or their experience who are very active during, say, a ketamine administration, or you can have folks who are lying down, eye mask on, noise canceling headphones, and I developed a music protocol that works in concert with what impasses or stuck points I need folks to address, and music often is a nonverbal way to get us right where we need when you're in a neuroplastic agent like ketamine, as an example. So you can have a lot of
music. Sorry, that's important to me. What kind of music?
So I do a double dose ketamine protocol, which so you'd have 90 minutes of.
No, he wants to know the jams. What jams are you playing?
Type of music?
So there.
Pina colada,
this is where it gets a little.
Buffett.
Yeah. So instrumental music to start, because in my protocol we do IM ketamine, and that's intentional, which
like
means
me. That was what I did to that woman.
Yeah. which means in about 3 minutes you're off.
Okay, that fast.
And so
that's about right.
Yeah. And so we do instrumental music and there's a lot of work on the psych side to help people.
And Damon, is this one-on-one or is it like group session or?
Yeah. So everything is individual. And then we have a group container that is very intentional. So as an example, my next retreat, we have 6 people coming. 3 are law enforcement or special service folks. 3 are business leaders. And so why that's important is because the group dynamic, when you're in a neuroplastic state, that gives you an opportunity to change, the group can either facilitate and accelerate your changes, or it can hinder them. So you have to be very thoughtful about the group dynamic. But everything about the ketamine administration, everything about the protocol is utterly idiosyncratic. We use the group intentionally when you're in a neuroplastic window to say, okay, let's get rid of the shame. Let's get rid of the part of you that feels silly or shameful or embarrassed about changing at whatever point of your life. And when you have folks come together, when they had 2 ketamine administrations with proper preparation, where we're getting to the roots, I do priming. So if it's a vet and they've had 14 traumatic situations, out of those I find the sliver, sometimes it's a color, sometimes it's a song. I find the sliver that relives in their brain out of those memories. I use that in concert with the music to help them approach it, confront it, and move on. In the group, as an example, in our immersive retreats, bolsters the part that basically it's unconscious, it's not spoken, but it says, we're all in this together in some ways. Let's find a way to move forward. So that was long-winded, but I guess I've never been called verbose.
That's great.
This could be like a 55-hour podcast because it's just so interesting, so great. I just want to get to the business part. So first of all, what does that cost? Can we tell folks what that costs?
Yeah. So 3,500 has been, and so I have a cheaper option for vets and special forces guys. Basically, folks who donate to the foundation can sponsor someone.
Got it.
That's
great. So 3,500. Hey, to get your head fixed, $3,500 is not a lot do I mean, in therapy, you could blow that out.
I should charge that woman more for the ketamine.
Truly. We do have tiers too, because there are folks. God honest truth, there are folks that the data is pretty outrageous. Where if you get someone to redirect their lives outside of how much success or not they've had. If you get someone to not on the most traumatic cases to not hurt themselves. As an example, I was at the APA conference in Denver recently for Division 56, which is the trauma division, and I gave a presentation there about innovation with PTSD, and the last slide I put up was calls from grandma. The reason being is because when you affect someone so much, the whole system reaches out, even grandma calls. And so there are tiers to what I charge. So I know why you think that. So, but people are changed.
You seem like you're such a passionate person about what you're doing. And by the way, I have just a ton of admiration listening to you talk. Cause I mean, the fact is you're like getting to help people every day. I mean, that's a big deal. So it's really cool. How do you feel about running your own business? Like how does that factor in? Is that tough for you? Is it like, how's that going? What are you feeling?
It is not my specialty. So I have a patent. I have data that is just outrageous. Retreat after retreat gets better. I don't mean that in a pompous way by any stretch of the imagination. I share that with humility. I am not the best business person, and in part because therapists tend to be a bit masochistic. It doesn't necessarily feel like we should be paid for trying to help someone, because every therapist, every provider. I have a partnership with the Wounded Healers, former just absolute stallions, former Army Rangers, who named their organization Wounded Healers because of the fact that they contend, and I think they're right, that every provider, whether you're a therapist, doctor, whatever, we all are wounded in some ways and are trying to help patients to deal with some of our own pain. So I share that as a long-winded way to say the business side of things has been interesting. Monarch has been a tale of two cities. It's been the highest of highs and been the lowest of lows. The first retreat I did, I had 2 trained assassins with me in Colorado, some special force guys who are Army Rangers, JSOC operators, private contractors, and I thought, Damon, if this protocol sucks,
get these people flagged up and take them out to the woods, dude. You could get a couple of. Take them out to the woods in the middle of nowhere.
Yeah, that's great idea.
Make sure my wife and these boys know that I went down swinging.
Don't tell your insurance, your life insurance people. Like that could be one of the questions.
Damon, do you feel like you're building a brand? Do you feel like people are starting to know about you? Like, do you feel that way?
100%. It's been it had to pivot recently a little bit for some reasons I won't go into, but it has been absolutely amazing. I have partnerships now with veterans and in the Army Rangers, Special Forces. I am now treating and now have a law enforcement ambassador. I'm doing a lot of work with law enforcement agencies. They won't call it trauma, but given the suicide and the hell that a lot of police officers and firemen, first responders are going through, they're calling it mental resilience, mental training. So no, it's been absolutely incredible. And then on the other side is you have lots of folks who just need to, are interested in expanding their mind. There's a reason that Rowan Griffiths, when he resuscitated the psychedelic studies at Hopkins, who did he treat? Terminal cancer patients who were on their deathbed, right, and had existential depression, anxiety, were terrified of death. Psychedelics, if done properly, expand your mind in a way that expands consciousness and forces you to think about things in a completely different way. Part of that is recalibrating your priorities, your values, what constitutes a good life. That's the blessing. I don't want it to sound like it's a panacea, because it has to be done thoughtfully, because neuroplastic agent can take you to the top of Kilimanjaro in a thoughtful way, or it can take you to the depths of hell in a way that is not helpful and defragmenting.
We're asking you about the business, and I just love you. Just keep coming back to, hey, we're helping people, and it's awesome. And I'm like, yes, I know, dude. It's amazing. I'm just trying to I think I'm trying to give you therapy, and when you give me therapy in whatever weeks or months from now when I see you, I'm just saying, like, was moving into like starting your own thing, was it an organic process, or was it just violent? Like, I need to go do this. Did you just feel like it was just burning?
It was absolutely difficult. God honest truth. It was issue after issue, problem after problem. And truly, once you, like, I'm a planful person, so I thought I anticipated the next 10 issues that would come up, and 10 issues came up on a Monday morning that had nothing to do with what I anticipated. So it literally, it challenged me in ways that I can't even imagine. It also, you have to be able to deal with uncertainty when you're, in my opinion, when you have a sense that your business plan has certainty because of the data, you have to be able to tolerate so much uncertainty. And I thought I knew that as a logical idea. And then when you get hit at tidal wave after tidal wave, tsunami after tsunami, I had many sleepless nights looking at the mirror saying, what the hell did you do, Damon?
Well, I think sometimes it comes in volume, and sometimes it comes in intensity, but the job is to hit it, have it happen, and get back up. And that's just what the job is. And it sounds like you've done it, right?
I think in any innovation, as you guys know, any innovation, you have to move outside of the box, go back to the box, move outside of the box, get hammered with uncertainty, go back in. And the beauty to me is if you can stay steadfast in your belief that you can go in the box and operate outside of the box, you can weather the blows. That's when you, at least in my experience, you keep going after it, you keep climbing.
That's amazing. All I have to say is we have to do a part 2 on this after I have my
I think we're going to have
3-minute protocol.
We have to do a live one.
I want to ask our some of our standard final questions if we can. And I think the one thing is, Damon, out of everything out that you're doing, you mentioned a lot of different modalities. I know it's different strokes, different folks. I get all that. What's the one thing out there in market that you're seeing, that you're doing, that you're like, this is absolute magic? Is there one thing you can just quickly say, this is the thing?
Psilocybin is incredible, particularly for massive mental health issues with comorbid substance abuse. Ibogaine is something that is unbelievable. Ibogaine has potential to, I mean, I've sent a couple special forces guys there. It's not legal despite Texas having an initiative now. Ibogaine seems to help with TBI. Ibogaine seems to reset opioid receptors. Ibogaine seems to
so that's like from the opioid addiction. That's where it's gaining legs, right? Is the opioid addiction?
And TBI, like the functional MRI, and we can't generalize because the data points are small, because folks, especially special forces guys, have to go to Mexico. But the functional MRI on traumatic brain injury, one session, and Ibogaine affects the heart. Ibogaine is sometimes an 18-hour trip, so you have to have people who know what they're doing. But one session, functional MRI on TBI looks completely changed. Opioid, I've had so many folks come back and their wives don't recognize them. And so there's a reason that pharma, right, is similar to every psychedelic compound. They're trying to isolate Ibogaine's psychedelic properties to package it.
Ben, do you want to ask the other side of that question?
Got to get the bacon. That's what they're doing.
Yeah.
Ben, do you want to ask the other side of that question? We talked about what's absolute magic out there. I think we want to know the other side of that.
Well, yeah. So in your whole space, and I think maybe in this mental health, whatever problema, what is complete people are doing? Like, what is out there? There's always something out there that people are pushing.
I think what psychedelics have illuminated is that as the New Year's Eve resolution that doesn't come to fruition. In other words, we want transitory fixes that lead us back into avoidance. In other words, we can have a checklist of external things that we think are going to make us happy. If I get to this weight, if I have this look, obviously those things are important. No one should be punished for trying to, I'm getting old now. I got to get back into the gym. But no one should be punished for whatever they do externally, I believe, to try to better themselves. However, there is no trend that absolves one from confronting what we all, to no fault of our own in many ways, sometimes rationally, what we try to avoid. Mental illness lives in the space in which we won't confront it. Trust me, I tried to run from loss and tragedy for a long time. I tried to pretend that I can save X number of people, and if I get to this number, if I get to this achievement, I can rewrite these wrongs from the past. There is nothing that can happen externally that will be a long-term strategy for happiness unless you confront the avoidance that has been protective. The people with trauma, case in point. It's not that, why do people booze when they have trauma? It's because their symptoms, the roots aren't addressed, and medications often don't help. So what do they need to do? They need to self-medicate at the moment when they start to get nightmares. It's good people trying to survive that becomes routinized and becomes autopilot. Our mind tries to tell us, right, that if I just do this resolution, this diet, then this will relieve the pain. That can help, but nothing will relieve the pain unless you confront the beast.
There's a lot of people out there that are actually doing better than they think they are, but they're comparing themselves to everything else out there, and it's creating like a life or career dysmorphia.
Truly, and so many. I mean, I've seen, so as an example, I've seen finance folks who they're comparing themselves to the top person at Harvard MBA. It's like, wait a minute. You can't stay on this. I mean, you can achieve and you should achieve, but at what point are you going to make your own assessment about what constitutes success, happiness? When have I made it? It sounds crazy, but even the most successful types, I've asked a vascular surgeon in his 80s on retirement, what constitutes success? What has been the best part of your life? He looked at me like I had 4 brains, like I was on psilocybin. He looked at me like I was utterly nuts, because these moments are a reminder that, hey, let's pause, be intentional, let's be thoughtful. The more you have hate and anger towards someone else is often indicative and reflective of a part of yourself that you're not satisfied with. So let's try to be thoughtful, and in terms of how we treat people, let's use aggression and frustration in the ideal sense to recalibrate ourselves. What we know since the Greek writers is that if you look internal, and if you look internal as a source of your growth, your pain, your vulnerability, the good life, good things happen. And unfortunately, we've gotten away from that, I think.
Well, listen, I think this was beautiful. It honestly, it kind of encompasses the whole goal of the podcast, which is just lines up really nicely with trying to figure out who the hell we all are and to get the most out of ourselves. Yeah. Damon, it's Monarch Protocols. Say your website if you don't mind.
Yeah, it's Monarch Protocols, the monarchprotocols.com.
The monarchprotocols.com. Okay.
Yep.
I mean, check them out. I think everybody deserves this opportunity to kind of just think about this space in their life. So I think you might help some people here. So because MD Hyperbaric is sponsoring this season, they're spectacular. There's a ton of benefits, TBI benefits, Damon, from Hyperbaric chamber. We're using it aesthetically from an anti-aging component, from a post-operative component. So we thank them. They're killer. MD Hyperbaric. Check them out. They're the best.
We're big fans of the Hyperbaric.
My medical director uses it often. Hyperbaric chambers. So
there you go. MD Hyperbaric has the legit chambers where they put you like really under pressure. Supposedly like the inflatable ones don't do it. They don't do the thing. You got to get in the tank, turn it up like we're scuba.
I was reaching for my phone because I'd love to take a look, because
actually we're gonna have it. We're gonna have it in Impressions. Listen, we're getting one. We'll
let you play with it, Damon.
Can't believe I'm missing the opening, but
that's all right.
Next time.
Perfect, okay. Guys. I'm sick of the
Damon,
dog.
thanks, brother.
Going to bed.
Appreciate you guys. Can't wait to see you guys in person.